Hello, I'm Michael Pearson. This is The Human Condition. Today we're talking about the medical industry and how your doctor thinks. When your doctor hears your complaint and thinks about what to do to help you, they have to triage you first. They have to think about what's the most lethal complaint that you might have that could kill you first. And so they have to deal with that first, and they have to gather evidence that points them away from that and either says, yes, I should get them to emergency care, or I have a couple of pieces of evidence that point very strongly away from the probability of that happening. So while your doctor isn't 100% sure that you're not having some horrible disease, they can ask you 2 or 3 questions, and then the likelihood of that, the probability of that goes way down in their mind, and they can move on to making sound, reasonable medical decisions. Now, as a patient, you may want your doctor to dive right into expensive and what we call sexy tests because, it's exciting and it's stimulating to say, well, I'm going to get an MRI, or I'm going to get a blood test, or I'm going to get this or that test that's scientific and technical and technological. I'm going to get an EEG of my brain. All those things are great, but it's extremely important to understand that we waste a lot of money and a lot of time, and sometimes we go with a false diagnosis down the pathway of something that distracts us, which is called a red herring, when you chase down something that's not directly related to your illness, or even indirectly related to your illness. So what'll happen is a doctor may jump ahead to expensive testing and treatments when they haven't done enough due diligence. Now, that due diligence involves the first triage, which is this emergency or not? Is it safe to proceed with, everyday kind of medicine? And then the next step is to take a very, very clear medical history. That means a family history. That means a personal history all the way back to childhood. That means a history of your surgeries, history of your medications, history of previous conditions and previous doctors that you've had, concurrent care that you're having now. Are you seeing a dentist? Do you have an eye doctor? When was your last eye exam or hearing exam? When were your teeth last cleaned? These are all important things that have to do with hygiene and health maintenance. And you need to realize that 90% of diagnosis does not come from sexy tests. It comes from medical history. And every diagnostic textbook will tell you that. If you read them, they'll say in the first chapter that 90% of diagnosis is from history taking. It means wise history taking, and not all history takers are created equal. Not all doctors are equally good at taking a history. Some doctors are better in certain types of illnesses. I'm particularly good at chronic illness. I'm not particularly good at acute illness. I never chose acute illness. I'm not an emergency room kind of doctor. I'm a chiropractic neurologist, and so I work with chronic, old, cold cases that have seen many, many doctors before they get to me, and they're chronic and they've been sick for a long time, and they're usually not dangerous because they're not dying. The patients have usually a lot of suffering and a lot of problems, but they're not in imminent danger of dying, although we see those too. When a person has a condition, whatever the condition is, the history is very important, but it's not the only thing. The next thing after the history that's extremely important, I think, is the observation and the examination. A good doctor can observe somebody, and that's half their examination. They can observe somebody, they can watch them sit and stand, they can watch them bend and move and turn their head and look and focus and think and ponder and approach and shake your hand and sit down and put a mask on and take a mask off. They can see all those things and do almost half of an exam that way. But a good doctor will also do a very detailed physical examination. And a detailed physical examination doesn't have to take a long time. A good examination could take 10 minutes or less. Certainly a neurologic exam often takes 30 to 60 minutes or longer, but a physical exam can be very, very good, and it can be extremely skilled, and it can take 5 or 10 minutes. We're talking about, simple examinations of basic features like vital signs and sensory and motor examination, and listening to the abdomen and the chest and the blood vessels, a basic neurological screen, and some orthopedic tests, and you're done in between 3 and 10 minutes. In fact, we're taught a basic neuro screening that's 3 minutes long for general practice doctors. Physical exams can be 10 minutes, and neuro exams can be, a pretty complete neuro exam can be done in 20 minutes at the bedside. Often we take an hour because we really need to explore things and ask questions and let the patient talk because things come up. But you can do a tremendous amount in 30 minutes with a neurological examination, which is my specialty. So whatever is the problem, don't leap right away to lab tests and imaging, because there are many, many lab tests that you can do, and there's a lot of imaging that can be done, but there's an order of operations. First should be the history taking, then the physical examination, then the deciding of what lab tests and what imaging should be done. And there's an order of those images. If a person's going to have a spine problem investigated, they really need to have spinal x-rays done first before MRIs in most cases. Although in some acute presentations, we jump right away to CT or MRI based on how emergent the situation is. Likewise with lab tests. Most of the time, we would like in chronic illness to do kind of a broad spectrum blood test that includes a biochemistry profile and a complete blood count, a CBC. So a complete blood count counts all the different kinds of cells in your body, in your blood rather. So white cells and all their differential types, red cells and all their different types and measurements and sizes and shapes, and then platelets, which is different kind of clotting cells. So the three kinds of cells that are current, in your blood mostly. And then a biochem profile is a general measure of chemistries. So it's blood chemistries like certain minerals, certain enzymes, and things that are in your blood that measure your organ, the effects of your organs and how they're doing, and a general screen. And often that's done with the standard urine analysis, which is a inexpensive, under $20 urine catch, where you catch the urine without trying to get it in the morning. It's not a 24-hour urine, it's just a little cup, and you try to catch that at whatever time of day, spot test of urine. And that's just a test of basic things. It's not a drug test. We're just talking about, a test of proteins and a test of casts, a test of glucose and looking for infection and all that kind of stuff, the pH, the color, all of that, specific gravity. These are basic tests that we start with. So typically a patient should come in and do those things first, even a child, if they've got something truly wrong with them, before we go on to special tests like, SNP tests and gene tests, things like urine specialty tests like organic acid tests, things like stool tests for various bacteria and dysbiosis and infections in the gut, and other specialty tests. Sometimes a patient will hear about a test and say, oh, I want that special test, but they haven't done the due diligence to do the other parts first. And they can really mess themselves up because they might miss something simple and easy that you would catch in the first screening test, which is the one I mentioned, the CBC and chem profile and urine analysis. Like they might miss a simple prediabetes. They might miss a adrenal problem. They might miss an anemia. There are many types of anemias out there that a person can have. So there's a bunch of screening tests that a person should go through to make sure that they don't have some kidney disease or some other disease or heart disease or a recent heart attack. And all those things will show up on the standard blood test to people that know how to read them. So don't get sucked into being seduced by a very cool test and not doing the other due diligence first, which includes the history, the examination. And I just can't help talk about the examination. The lost art of examination just drives me crazy. People aren't taking histories and doing examinations much anymore. The doctor talks to you and they might swing a reflex hammer at you and wave a stethoscope at you, and then it's off to the MRI machine, or it's off to take a drug or write a prescription, or it's off to take a blood test that only includes 2 or 3 markers like your cholesterol, your LDL, and your hemoglobin A1C, and they don't look at the rest of you. So this really bothers me as a clinician, and I just want you to understand that don't get sucked into that. It's very important.